What is Nissen Fundoplication?
Fundoplication is a surgical method to solve the problem of reflux, in which medical treatments are not enough for treating this disease.
Who is a candidate for Nissen Fundoplication?
Patients who have serious reflux symptoms and who didn't benefit from medical treatments and lifestyle changes are the most common candidates for this surgical treatment. Also, the reason of the reflux symptoms should be evaluated before the surgery, so endoscopy and pH monitoring tests are very valuable in this area.
How is Nissen Fundoplication performed?
This surgery is performed laparoscopically. In this surgery, we insert 3 to 4 trocars over the belly and we insert a camera through the trocar. We focus on the upper part of the stomach. First, we open the hiatal area. We focus on there. If needed, we will put stitches on the hiatal side and make narrow there. And then we make a wrapping in the fundus part of the stomach over the esophagus and we put stitches there. By this way, the upper flow of the gastric acid stops and this wrap will force the lower esophageal sphincter.
What are the benefits of Nissen Fundoplication?
Nissen Fundoplication brings an anatomical change in the hiatal and gastroesophageal area, and by this way the reflux of the gastric acid to the esophagus stops. And in the normal life, patient increases their comfort about different symptoms, because reflux patients have symptoms like burping, belching, and all these symptoms may stop with a successful surgical intervention.
How effective is Nissen Fundoplication?
If the patient's selection is true before the surgery, the effectiveness of the fundoplication surgeries are more than 90%, but even this success, around 1 to 2% of the patients may have different problems after surgery.
Will patient able to eat normally after surgery?
In fundoplication surgeries, we are creating a wrap over the esophagus with fundic part of the stomach, and also during the surgery we try to make tight fundoplication, but sometimes around 1 to 2% of the patients may have difficulty swallowing after the surgery, but mostly there is no eating problem after fundoplication surgeries.
How long do the results of Nissen Fundoplication last?
In fundoplication surgeries, if the patient's selection is proper, we can see the results even in the beginning after the surgery in the first week, but sometimes, according to the ODAM in the surgical site, at the end of the first month, patients may give feedback about positive results of the surgery.
How long does the procedure take?
Fundoplication surgery takes around 1 to 1.5 hours, and also patients need to stay in the hospital 2-3 days.
What are the potential risks and complications?
We can say complications as bleeding around 1% and infective problems less than 1%, and in the midterm and long term, difficulty swallowing problems around 1 to 2% according to the wrapping of the stomach.